in the United States, the pandemic did hit minority populations particularly hard. So Asian Americans were blamed in some quarters, completely unfairly. There's been a really disturbing rise in anti-Asian hate crime. People of African American descent and Hispanic Americans and certainly Native Americans, the indigenous population in the United States, have been just devastated by COVID-19. In part, it really has to do more with structural issues than anything else. I mean, there have been a number of discussions of the idea that racism was a pre-existing condition for contracting COVID-19 and for dying of COVID-19, because people of color were more likely to be essential workers. They were more likely to not be able to work from home. They were more likely to live in crowded communities where the spread was faster. They were less likely to have good access to healthcare. I mean, just almost in every way you can possibly think of. For the one positive thing, and in some ways that I think has come out of this, is that I think there has been more journalistic attention to these social determinants of health than I have ever seen before. The idea that journalists have begun to acknowledge, and one hopes to put pressure on governments to acknowledge, that transportation policy is a health policy, education policy is a health policy, housing policy is a health policy or has health impact. And then, of course, in the middle of the pandemic, we also had the George Floyd murder and the subsequent trial and the Black Lives Matter protests, and it all got wrapped in together and influenced the political outcomes in a number of ways. I would like to think that it will have elevated the voices of people of color, but at the same time, it has been problematic.
In the spreading and responding to COVID-19, Korean society has expanded its unilateral judgment, discrimination, and hateful sentiments towards specific groups. The mass infection and explosion of confirmed patients centered on the Shincheonji Church in Daegu led to the hatred of the certain region and religion. In addition, there were cases in which socially disadvantaged could not secure masks, and unregistered migrant workers who were afraid of threat of overseas deportation were also found to have avoided COVID-19 tests, which led to the further spread of virus and lack of medical care for these people. What's more is that the issue has further aggravated and expanded into hatred, discrimination, and stigma against confirmed COVID-19 patients. As a result, extreme nationalism, generational, gender, and regional conflicts, which has been raised many times as a serious issue within society, has intensified during the COVID-19 period and are expected to last longer and not end as a temporary issue. However, this problem is not an issue of Korea, and as many similar cases has been reported globally, including United States, European countries, and even Australia. So to protect and develop democracy and create solutions to these permanent and various changes and problems that arose during the COVID-19 period, cooperation among the countries in the Asia-Pacific region and international cooperation in a bigger picture is essential.
The issue in New Zealand is the Maori vaccination rate. But interestingly, there's also an age element to that too, because a lot of Maori in New Zealand are actually young. Like, they've got a greater proportion of young people in that race than any other. So we had a problem because, like Korea, the New Zealand government rolled out vaccinations according to age groups. So it was 60 to 70, 50 to 60, and so on. So that meant that the majority of Maori were hanging on, waiting for a long time until they were eligible, by which time Delta had come to our shores. So that has really put the Maori population at a disadvantage. In terms of putting the focus on their voice, though, I think because of that, there has been quite a big focus of the media on their voice, and the Maori Party themselves and other key providers have been lobbying for all sorts of information to try and reach Maori, and arguing there need to be different ways to reach Maori people. But there is that undercurrent again, which links with the US a bit, in that there could be a potential divide where we all are being made aware of the lower vaccination rates of Maori, and other members of the population may feel that they're being held back and held inside and in lockdown while they're waiting for Maori to get the vaccination. And I'm like, well, why don't they just go and get it then? And then there's also concerns about disinformation and false information coming through on Facebook into, into their social media feeds, which, because they don't consume mainstream media, that can't act as a blockage on that. So it's interesting, COVID, because it's raising a lot of issues that have been on the agenda, but it's putting them first foremost and front of center, I think. And we're seeing different aspects, the same issues, traditional issues, played out in different ways, and really making us, give us thought for concern, I think.